ADHD or Attention Deficit Hyperactivity Disorder. Okay, it's not only for children, but you can also be diagnosed during your adult years. But the symptoms must be present before 12 years old. Okay, at least 5 symptoms from the criteria of DSM-5 that you should consider. For inattention, first, you have difficulty in following through instructions. And then, after giving the instruction, you have difficulty understanding it, as well as remembering the instructions given to you. And if you have to do tasks given by your teacher or coworker, you have difficulty finishing it, or you are easily distracted, especially if the task is boring or repetitive. So, nahihirapan kang tapusin yung mga boring na bagay, or mga tasks or gawain na paulit-ulit na lang. Okay, you also have difficulty remembering instructions na binibigay sa'yo. Aside from that, after finishing the project or the task, you have difficulty remembering, no? Or remembering saan mo nilagay yung mga bagay-bagay. Like for example, if you're doing something sa bahay or sa house ninyo, you have difficulty remembering where did you put your car keys, your materials. Okay, you have difficulty remembering a lot of things. Okay, poor concentration, especially if you have ADHD. Aside from that, you also experience a disorganized thing. Disorganization of things. So you are not you are not organized when it comes to your things at home or things at work. So parang burara, or yun nga, makalat, something like that. Or at times, no, co-workers or family members would often inform you that you have to fix your things, okay? Mostly all the time. So next would be hyperactivity. So hyperactivity, usually the symptoms would be fidgeting. Like for example, you're talking in a long period of time and you fidget, you squirm in your seat, or hindi ka mapakali. You're easily distracted by the noise outside or here in the room. At times you really want to stand up, especially if long period of sitting. Like if you're working or you're inside the classroom, you want to stand up from time to time, even the teacher is talking or the boss is giving instructions, or there is meeting or workshops, you have difficulty staying or listening to the discussion. Hyperactivity and impulsivity, pwede din na during conversation, someone is talking or your friend is talking, you want to butt in, you have difficulty controlling yourself, and you really want to finish what he or she is talking. You want to finish it, and then when you're talking, or you were actually waiting for your turn, or you're waiting in a long line, you really want to be the first one, because you really are impatient when it comes to waiting for your turn. Okay, so there are just some of the symptoms of ADHD. There are times that if you have mild ADHD, it can also be overlapped with symptoms of anxiety. So it's really helpful if you seek the advice of your psychiatrist or psychologist, for that matter, if you will be diagnosed with ADHD. But if you need treatment, of course, psychiatrist would be the one who will actually help regarding the treatment with ADHD. Okay, for children, usually developmental pediatrician would actually assess the child. But if there is behavioral problems, well, child psychiatrist, general psychiatrist can actually assess the person or the patient who have ADHD. There are actually therapy that can be done with ADHD, and CBT or cognitive behavioral therapy are one of those suggested or recommended therapy for ADHD. So cognitive behavioral therapy focuses on problems with your cognitions, how you deal with things, okay, automatic negative thoughts that affects you as a person having ADHD. Okay, we also have to rule out other conditions that can be the cause of ADHD, or it can overlap with ADHD. But based on experience, usually if persons with ADHD have anxiety or depression, they really have difficulty um, doing tasks because aside from ADHD, they have depression and anxiety, and the medications are actually it's not really compatible with medications with ADHD. I mean, there are a lot of side effects, and usually patients would always complain regarding the effects of the medications. If both ADHD's medications and psychiatric medications or antidepressant and anxiety would uh, be given or be taken together. Okay? So I hope you learned from the lecture about ADHD. So for concerns, clarifications, you may want to comment on this video and share this information to your loved ones so they'll be aware. Keep safe and God bless.